Good afternoon, everyone. My name is Mike Alexander, and I'm the Director of the Center for Livable Communities at the ARC. Welcome to this week's weekly webinar program. This week we are talking about the regional philanthropic response to the COVID crisis. But before we get started today, I want to say that we are deeply pained by the recent killings of George Floyd and now here in Atlanta, Rayshard Brooks. We know that this is part of a long history of violence against Black Americans, as we've seen with the recent deaths of Breonna Taylor, Ahmaud Arbery, and the many others, and this year alone, they exemplify America's 400-year history of systemic racism. The physical, social, emotional, and economic toll that this has taken on our Black community is incalculable. We're still in a COVID crisis. Our case numbers continue to bounce in the middle without real decline. And so it's absolutely relevant, given the economic impacts of the COVID crisis, that we talk about what we're going to today. But before we get started, I want to acknowledge that we are using the GoToMeeting web platform. I know we've been using this for a while, and given that many of us have done hundreds of these meetings now, we hope you're familiar with this tool. There's obviously now tools on the right side and pop-ups. Today for this webinar, you'll have the opportunity to submit questions or comments by typing them in the questions panel on the far right. We will take questions in an open-ended discussion session at the end. Of course, your microphones are muted right now, and we will continue to have them muted throughout the presentation. Today's webinar will be recorded on this platform. The recording will be made available to all meeting attendees via follow-up email and will be posted on ARC's website with the presentation slides. Okay, let's begin today's webinar. The COVID crisis has put all community-based organizations in uncharted waters. As they seek resources to stabilize and address the future, philanthropy is uniquely positioned to provide help. This webinar will highlight the work of the Greater Atlanta COVID-19 Response and Recovery Fund, a partnership of the Community Foundation and United Way, and the Arthur M. Blank Foundation. Today, you will hear about the scope of the assistance provided and plans for continued support as our region recovers. First, today, we're going to have Lita Pardi, Vice President of the Community Foundation for Greater Atlanta, tag teaming with Katrina DeBerry, Program Officer for Thriving Communities at the Community Foundation for Greater Atlanta, followed by Katrina Mitchell, Chief Community Impact Officer for the United Way of Greater Atlanta, and finally, Frank Fernandez, Senior Vice President for the Arthur M. Blank Foundation. With that, Lita and Katrina, you are presenting. Thank you.
Thank you, Mike. Hi, everyone. It's great to be here. So as we talked about how to have this webinar, this conversation with you all, we thought that we'd take a few minutes to also share beyond the work that we've done in partnership with each other, just to touch for a minute on the work that we're each doing in response to COVID. And so I'll just take a minute to introduce myself and just talk for a minute about the Community Foundation. So I'm Lita Pardi with the Community Foundation. And in case you're not familiar with us, we seek to lead and inspire philanthropy to increase the vitality of our region and the well-being of all residents. We've been here in Atlanta for, I'd say, close to 75 years, connecting donors who are passionate about our community and the community's needs to nonprofits addressing those needs. And so every year, donors recommend more than $100 million in grants to organizations across a number of issues. And in the past 3 months, we've seen our donors direct close to $20 million in funding to organizations that are addressing communities impacted by COVID. Of course, every community is impacted by COVID in one way or another. And so as we have approached our joint grant making with United Way and the Blank Foundation and others, we've also been doing a lot of our own work. And at the Community Foundation, we've been talking about focusing on equity of opportunity since last year. You may have heard our president, Alicia Phillip, talk about this. And we've spent a lot of time talking with folks, probably talking with some of you who are here, doing a lot of research and just really trying to see where and how can we have the greatest impact in our region. And while we're still figuring things out, we know that I'd say prior to coming into COVID and especially I'd say because of COVID, we know that at the heart of change that needs to happen in our community are relationships that we have with community. And so we've been talking a lot about who do we partner with and how we work with each other. And what COVID has done in all of our work, I'd say, is really called us to see who are we not talking to, who are we not partnering with, and to think outside the traditional boxes that we think about. And so as funders, we often turn to nonprofits to work with, but we've also in the past individually and collectively worked with different government agencies and I'd say for-profit groups. And so we're trying to identify who should we be partnering with beyond the nonprofits that we support to have significant impact and to have the kind of systems change that we're all looking for. Katrina, you want to talk a little bit about our work?
Sure. You know, I like to preface my conversation by saying I think I started out my career at the ARC, so I know the value of making connections with community, local government stakeholders, and nonprofits to collaborate on issues that are important to our region. And I think the regional perspective is one thing that is kind of innate to how we at the Community Foundation try to do our work. And it's why we see so much value in the partnerships that we have with the Blank Foundation and the United Way and many others. But one of the things that we do on our community team is try to find that balance with how do we provide resources to those nonprofits that impact and support our communities in a thoughtful and thorough way and still be able to reach as many as possible. My pillar is the Thriving Communities pillar, as Mike mentioned, which really digs into direct connection with community. So that means the basic needs that we seek to address and that have been exacerbated by COVID-19, things like affordable housing, access to opportunities, transportation access, enabling and enacting community and civic voice are the things that we try to highlight, but they are not things that I do alone. We have other program officers who focus on the other issues that we face in community, things like education and well-being. And so we really strive to make multiple connection points with community and provide those resources. Lita, if you want to talk about, get into the COVID-19 response, I think that would be a really good way to show those connections between our existing work and where we're moving to next.
Sure. So if you could go to the next slide, please. Oh, no, actually, no, sorry. If you could just come back before you get to peek at that data. So the Greater Atlanta COVID-19 Response and Recovery Fund really we got started very quickly, I'd say. It was probably exactly 3 months ago when the president of the Community Foundation and CEO of United Way talked over the weekend and the week leading up to all of the closings due to COVID in mid-March, and said, we need to do something together. We were seeing this happen across the country. United Ways and community foundations partnering with each other. We exist in every single state. While we don't cover every single county of the states, here in Metro Atlanta, between the Community Foundation and United Way, we cover 23 counties. So it's a pretty big region. And we knew that bringing our teams together, bringing that capacity to work together would be the way for us to really support our region. And we were very pleased that within a matter of days of the announcement of this fund, we had others like the Blank Foundation and the Coca-Cola Foundation step up in a significant way to join in supporting the fund. We came out very quickly to say we had not quite identified all the priorities that we had yet. We needed probably a week, 10 days at most, I think, Katrina Mitchell, right? To, I say, get to know each other very quickly, more than we already knew each other, and figure out how we were going to do this together. And one of the first things that we did was we knew we needed to have some, I'd say, volunteers from each of our boards serve in an advisory capacity, so that we would have some outside voices asking us important questions about what we were doing and giving us some good advice. And so we had 2 volunteers, 2 board members from the Community Foundations Board and 2 board members from United Ways Board come together and agree to serve in this capacity. And between the staff and our volunteers, we pretty quickly identified 7 priority areas, which I'll touch on in a second, and identified a way to start responding to the community's needs very quickly through some grant making that didn't involve grant applications, and then move to a more formal application process to give organizations across our region the opportunity to showcase, what they were doing for the community, what their needs are, and how they were responding. So you can go to the next slide now. Thank you. What you'll see is that in the last 3 months, we have distributed $17.3 million in grants to 320 nonprofits. Now we've brought in a little over 21 million. And so we still have a little over 4 million in our bucket. And right now we're pausing our grant making, and Katrina's going to talk about that in a minute. But we moved pretty quickly through 6 funding cycles. In a few weeks, we had awarded a significant amount of funding, about $12 million, in funding in the first few weeks. So there were some grants that were pretty big. You see the grant range was from $1,500 to $750,000. In those first few weeks, we made several $750,000 grants to organizations like the Atlanta Community Food Bank. We made large grants to the YMCA and also to Open Hand. And we followed those grants with dollars out to school systems and other types of organizations addressing, as you can see on the right-hand side of the slide, a number of different areas of need. The data points that I just want to showcase here are, we had identified 7 priority areas: food security, emergency financial assistance, education, health, housing, childcare, and small business. And as you can imagine, in trying to serve 23 counties in a metro area, we had to think about how COVID was affecting different communities in different ways, and make sure that we weren't using like a one-size-fits-all kind of process to our grant making, that in some cases we were reaching out to organizations in counties that we hadn't heard from to make sure that we were providing support to as many of our region's residents as possible. You'll see that there was a significant amount of funding that went towards food security, but also very significant was the emergency financial assistance. As you all know, with unemployment rising and I'd say folks just whether they were unemployed or furloughed, just the income not coming in for their homes, it just meant that a lot of people were not able to pay rent and mortgage, not buy food, maybe not even pay medical bills, and not just bills that were related to COVID, but just like day-to-day kind of expenses. And so the fund stepped up in a major way to really support our residents there. And we also stepped up really in the space of education. I'm sure you all heard about how many children did not have access to their the educational offerings that the schools were providing because they didn't have the hardware, the technology, or the internet connectivity. So the fund provided a lot of grants to school systems to help in those areas too. So you see that the funding ranges from I'd say needs that were present, by individuals to things like at the bottom of the list there you see small business. We only supported 9 agencies in that category, but it was pretty significant, the amount of funding that we were able to give out to organizations that are connecting with entrepreneurs to help them stay afloat during this crisis. So I'm going to turn it over to Katrina Mitchell, who's going to talk a little bit more about the fund.
Sure. Thank you. I'm grateful to be here with you all. So as many of you all know, United Way really has been supporting the Community Foundation and working in partnership around the fund. I'm going to talk a little bit more about the fund and then give you a sense of some of the other kinds of relief efforts that we've been involved in as well. So a couple of things to note. One of the things that we decided towards the latter part of the fund was that we had an open round, and that was really important. We opened it up to nonprofits across the 23 county regions. We had more than 600 plus nonprofits apply. And so this was important because we wanted to give large and small organizations an opportunity to access resources from the fund. We also really tried to make sure that some of the things we paid attention to, as Lita mentioned, was thinking about the disproportionate impacts on communities of color as we were watching what COVID was doing. And so you'll see that many of the organizations we were supported were organizations like the Atlanta Wealth Building Initiative that did focus on small business, but we also supported refugee and immigrant focused organizations who were thinking about the needs of particular populations. We also, as the grant cycles went on, really did not just focus on those large organizations, because we recognize in certain counties and communities, there were small grassroots community-based organizations who were meeting the needs of families. And so nearly half of the agencies we funded, particularly in that open round, had budgets of $1 million or less. And so that was important to us because we really wanted to make sure that the dollars weren't just going to the large regional organizations, but organizations who were particularly focused on specific communities or populations. One of the things we started in the very early stages was, one, paying attention. As you all know, well know, 211 at United Way fielded lots of calls from families who were needing assistance. That helped us to also identify what were some of the needs we need to focus on. Food and emergency assistance from the very beginning happened to be the 2 highest priorities for families who were calling in. And that was important data to help us guide what we needed to be funding in the early stages. We also developed a digital listening tool. We recognized that there were lots of nonprofits in the very early stages that were struggling with lots of things, and it was our way of being able to understand what were the needs. And they identified some needs that, to be honest, are still needs today and still things that are important. That was the funding challenges. By the time COVID hit, and we went to shelter in place, many of our nonprofit organizations were in the midst of their big fundraising cycles. And so they were going to have significant challenges around funding. So this was going to be an important resource for many folks. Supply shortages. There were lots of folks who really just needed cleaning supplies, PPE supplies, to be able to support their ability to open up their facilities or offer resources to family. Many of them had to move to different kind of technology platforms. Just like all of you all, we spend a lot of time in our office going straight to Zoom and virtual platforms, but in reality, there were many nonprofits who were struggling with how to do that. In the health space, people went to using telehealth models, but in many of the education organizations, they really had to rethink what their model was. Organizations like Sarah Familia, who provides those mental health services for families, they had to figure out how do they continue to do that and meet the needs of the Latino families that they serve. And then you also had educational nonprofits who were, since schools weren't in session, how are they interacting and talking to families on a regular basis and trying to find some virtual platforms to do that. The last piece that continues to be something that we're paying very close attention to, and that is the increased need for services. So not only were agencies having to serve the families they were accustomed to, they also were having to serve families who had not accessed them. As the days and weeks went by, the unemployment rate started to skyrocket, and that meant there were even more families who were accessing nonprofits for services. And so those continue to be what guided us through the weeks of funding and what helped us to determine how to deploy the resources. The last pieces that I would say is, we are taking a pause, and part of that is to do a few things. One is to talk to those organizations who did receive funding from us, and get a sense of, how have they used the dollars? What are still the needs? We know that there have been a number of CARES relief dollars that some agencies have been able to access, the Paycheck Protection Program, but we also know there's still probably some gaps. And so that's what we're trying to assess for, is where folks supporting. Particularly, we want to pay attention to organizations that are serving and led by communities of color and figure out where are there gaps, are there continuing to be gaps, and how else can the fund serve and support. The next thing that we are planning to do is to convene some community voices. When we got started, this was a rapid response fund. And we did have the core volunteers, but we also our teams also wanted to make sure we were talking to all those important community voices so that we could really determine how to best utilize the resources. We continue to think we're still in response. I think we all want to be in this recovery space, and I think we all acknowledge that there's probably not a turn on switch that recovery starts tomorrow. We're going to be in this space for a little bit. And so part of our role is to listen and learn to the nonprofits, to understand what the needs continue to be and determine. When we started the fund, which really was over a weekend, Lita is absolutely right. It was probably over a Sunday, Saturday and Sunday. We really wanted to quickly be able to know we were going to have to emerge. Those priorities might shift. And so while we have these 7 here, we recognize there may be some other priorities we need to think about. And that is how we are framing how we're pausing. Our anticipation is by the end of the summer, we'll be able to open up some guidance. And so, but again, this is about us listening and doing some listening and learning to nonprofits as we think about what the journey is next. I'll just quickly talk about United Way. We had been in this moment in time really trying to work on our child well-being agenda and really driving what we felt were all the things that are important to make sure children and their families are well. And that meant all of these basic needs were important, but also, all the things around workforce development and thinking about what is it that families need to be well. And so that continues to be the work that we are engaged in. What we did do is, as some of you may know, develop the child well-being map and index with the help of Neighborhood Nexus. And that really helped us show that there were certain communities that were in greatest need, that we defined as low and very low child well-being communities. And those places were largely communities of color, largely where the poverty was high. And so we recognize that those are also communities that have been under-resourced for decades, that COVID exactly exacerbated what was already existing, and made the challenges even deepen. And so that is something we continue to pay attention to. We did partner with BET, Black Entertainment Television, because we knew that there was a disproportionate impact on the Black community. And so we were able to direct more than $2 million in resources to nonprofits who are led by or serving the African American community, and they all were doing things from food to emergency assistance, all the important ways. And so we will continue to advance our child well-being work because we recognize that COVID just unveiled what we already knew these communities were struggling with, and that the challenges still remain, and that our work is still to be done. I think we will all recognize that we need to think about minimizing learning loss. Food insecurity is still going to be important. Workforce development is going to be critical as people start to get back to work. And so for us, this just said, we've got to continue on our road of bringing resources together to help support those communities of greatest need. And we will continue to do that in partnership with others, but also in advancing the work we've been doing and listening to our 211 calls, because we're still getting lots of calls around food and emergency assistance. I turn it back over to you, Lita, and the team.
I'm good. I think we're ready for Frank.
No, and we really appreciate that, Katrina, Lita, and the other Katrina DeBerry of ARC fame. With that, we'll transition over to Frank. So Frank, do you want to take off? And I don't know if you want to show your screen. I don't think so. You don't have any slides, I don't think. But
no, it's just me. I think
okay.
we're. I'll just share a little bit of remarks and try to build on what you just heard from the Katrinas and Lita. So for us, these two concurrent crises that we're experiencing right now, because I don't think you can just talk about COVID without talking about the racial injustice kind of moment we're in right now, clearly have a lot of challenge connected to them, and clearly they are both very intersectional, right? They're very interconnected. And to me, I just want to kind of share a few things that kind of, I think, highlight and underscore this point. For one, as I think many of us have repeatedly heard, this public health crisis, and I think Katrina mentioned this, is having a disproportionate impact in communities of color. And I'll share 2 data points that really underscore that. One is that over 80% of Georgia's COVID-19 hospitalizations are African-American Georgians, right? Doesn't get any clearer than that. And then another one that is data-driven but a little more localized is, one of our grantees, CORE, that's doing comprehensive diagnostic COVID-19 testing across the region, shared this following stat last week, where they have multiple sites across the region now, and at most of their sites, the positive testing rate is just under 2%. But now in the testing sites they've done along Beaufort Highway, which is a high concentration of undocumented, mostly Mexican residents, the positive test rate exceeds 13%, just to give you a sense of how this is impacting folks differently. And the other piece connected to that, and this is why this stuff is so interconnected, is we know that the non-health impacts are similarly disproportionate and actually contribute, creating this kind of loop to the disproportionality within health, right? So for example, we know that Black and Brown residents are disproportionately essential workers. And this is a stat I heard actually that was in The Economist a couple of weeks back, where if you make less than $25,000, you're twice as likely to be laid off or furloughed than for those workers who make more than $80,000, right? And so I share all that because I think it's just important, because these crises are having a significant negative long-term impact on folks, and especially underserved communities. And that is, I share that because that is the population that we as the foundation are most concerned with as it relates to what's going on right now. And lastly, for me, and this is, I think, an important thing in terms of a frame to think about, is that it underscores what so many folks already knew, and we've learned through our disaster relief work in the Caribbean, which is that when a major crisis hits, those least equipped to deal with it are those most negatively impacted, right? And we see that over and over and over again. And I think this is just repeating that. And that's true both in the short, and I think it's important, and the long term. We saw that after 2008. We saw that in Katrina. You see that in these crises that come up, whether man-made or natural. That's the phenomena. And in order to change that dynamic, we, philanthropy and everyone working together, need to act and think differently. And I think that's really important. Now, one of the silver linings, and there are a few, I think, in these crises, is that they are pushing us, pushing philanthropy to think about its business model and to take a step back and reevaluate who and how we fund folks. And that, in my view, is a good thing, right? So we're in this moment, and I think you heard from the folks at Community Foundation United Way, ways that folks are starting to do that, and I think that's an important, good thing for all of us. So given that backdrop, how has the Blank Foundation approached its work during this COVID crisis and now this other crisis around, as folks have already alluded to, has been around for centuries, but we're now, for lots of different kind of alignment of stars, we're actually paying attention to. And so I would start for us is just kind of highlighting a few key, I think, guiding principles in terms of how we try to do our work. The first is that we've always tried to do this, but especially now, is try not to be dogmatic, right? Needing to look at, again, harking or kind of emphasizing this point of reevaluate everything we're doing, our traditional way of doing business, and saying, does this make sense in this current moment? Right? And then hopefully over time, we will keep that lens and say, does it make sense to keep over the long term or not? These changes, or we need to go back. And sometimes, and my hope is that some of the answers will be that we have to change, and some we may need to keep. But it's important not to be dogmatic. There are no sacred cows right now. The second would be is a need to take risks. If we only do business as usual, we will not make a dent in this, because as Katrina and Lita pointed out, this situation is getting worse, not better. We're having more folks come and having different challenges they're grappling with. And so we have to be willing to take risks. And then the third one, which I think everyone's mentioned it's in some form or fashion, is the need to be more collaborative, both with our fellow foundations as well, and importantly with the public sector. And I think that's one I'll talk a little bit more about in a little bit. And lastly, for us, we've tried to use, especially as it relates to COVID-19, from a framework perspective, the framework that's most often gets used within the disaster relief world, which is thinking about these three big buckets of resilience, response, and recovery, right? So resilience is, how do we prepare for the next, whatever the next big crisis is, the COVID-19 crisis, so that we are better able to withstand and protect folks from the negative impacts, right? Response, which is what you've been hearing about, and I'll talk a little bit about in terms of the immediate aftermath of a crisis. And then recovery, obviously the longer term recovery. And as Katrina noted, that's kind of, while they're still doing the response stuff, they're also having to starting to take that step back to think through the long term. What do we need to contribute to help with that long term recovery for underserved communities? So that's I think the principles that guide what we do. And in terms of our response, since the crisis started a few months ago, the foundation's committed over $10 million toward as part of our initial response. And most of that has been focused here in the Metro Atlanta area, but also in other markets that we have significant presence in, Montana as well as Arizona. And most of these funds, at least that have been dispersed thus far, have been really focused on the very things that were delineated already in terms of food security, equitable health access, mental health, homelessness, emergency housing, rental assistance, small business assistance. Another thing that I think is characterized, and I think the folks at United Way and Community Foundation done a good job with this, is how do we strike the appropriate balance between supporting larger nonprofit partners who can address challenges at scale, while at the same time supporting those community-based groups, especially our Black-led nonprofit partners, and finding that appropriate balance. And it's not going to be the same in every issue area, but always keeping that top of mind and front and center in the work we do. Another thing I would say is, in alignment with the need to be flexible, we have made all our grants unrestricted and expedited the review process so that we can truly respond rapidly, which is something philanthropy does not do a good job of. I used to make fun of higher ed institutions because they were referred to as the thundering herd of turtles. And I think philanthropy is only a small step behind that in terms of how fast we historically have moved, but I feel like all of us have tried to really move more quickly than we historically have. And then in alignment with the need to take risk and be collaborative, we've done a few things. And first, I'll just, as already been mentioned, we invested in the Community Foundation United Way Response to Recovery Fund because it is so important to be collaborative. And I think the work that both United Way and Community Foundation have done has been a great manifestation of what collaboration can lead to. And I do want to take this moment to commend both Lita and Katrina personally, because they've done, in my view, an amazing job in terms of having to move really fast. It gets set up over a weekend, and then you got people like me harassing them and a bunch of other folks harassing them. Like, you got to do this, you got to do that. And they've managed it very gracefully. So I appreciate their patience in working with us, and I'm sure all the other foundations who have no shortage of opinions. So that's one big way. And then the second big way for us has really been in response to feedback we got from our nonprofit partners, our public sector, private sector, and some of our other philanthropic partners. We ended up standing up at the beginning of the crisis with our partners, a greater kind of Atlanta COVID-19 rapid response working group. And the working group has really been focused on helping just to share information and helping to try to coordinate efforts across two big dimensions, right? One is sectoral divide, right? So across public sector versus private sector versus philanthropic, nonprofit sectors, as well as issue area, housing versus health, homelessness, food, because, and it's, we consistently talk about the need to move away from silos, but there's a reason why we are always talking about it, because they're so natural for them to form. And during a crisis, it's even more problematic because we just don't have time. We don't have the luxury of time. And so part of that was a big part of the motivation with that group and trying to keep it flexible. And so for us, it's enabled us to be able to take some risk and try to really push collaboration where we could. And I'll try to lift up a few examples of that has arisen as a function of that working group. One is a pilot project that we help support that CARE has done. CARE, we've funded CARE and partnered with them internationally in some of our international stuff, but they were interested in wanting to bring their expertise to the United States and here to Atlanta, their hometown. And so one of the things we were able to do, because they have this disaster relief expertise and a large platform, they were able to partner with a few national corporations, TaskRabbit, Lyft, and Uber, to try to address two issues at once. The first issue is, especially during the first few months where everyone was in lockdown, people who couldn't leave their home, whether because they were seniors at high risk, disabled, or what have you, they couldn't get access to food. They couldn't get access to medication. And some, because MARTA had very limited runs, weren't able to get to critical health appointments, right? And so what they ended up doing was developing that partnership with those gig economy companies to help provide and food delivery, medication delivery, and other things, and at the same time pay the workers, the gig workers who weren't being able to work because no one was taking Uber or Lyft or what have you, so that they could get paid. And then those companies deferred or basically didn't take their fee, but the workers still got paid, right? So it was trying to kill two birds with one stone, and also testing out some ideas around that last mile of service delivery around critical social needs and thinking that through. And so for us, we helped seed the funding and also try to bring together some of the nonprofit partners that are part of the working group to be the pilot cases, with Chris 180, working with the food bank and a few others, and connecting them. And so to me, it was a good example of everyone's interested in the same issues, but they don't necessarily have relationships. So how do we really fast, within a few weeks, connect them and get the pilot off the ground? So that's one example. Another one is a really good long-term partnership with the city of Atlanta and its chief housing officer, Terry Lee, to really looking at, as has been already mentioned, housing assistance is one of these things, and rental assistance is one of these big issues that's bubbling up, and really thinking about what can we do to be helpful in that regard. And in that instance, to me, it's about partnering strategically and smartly with the public sector, because, this is for example, over the last month and a half, the city and council and the mayor have prioritized this issue of rental assistance to the tune of $27 million among the different buckets that they want to put towards housing financial assistance. However, and we know this from prior crises, it has a fuse. We have to spend the dollars by the end of the year because that's the way public dollars work. It's not as flexible as private dollars. And so part of it for us is, okay, with our dollars in partnership with House ATL and others, how can we help grease the wheels and fill in those gaps so that we are most strategically and leveraging all those dollars, because we don't want any of those dollars to go back to the feds. We want it to stay in our community. But we know the city can't move fast. And so part of it was trying to identify what are those places that we can help facilitate and accelerate this effort and this intention, right? And so working closely with Terry, with Katrina, and a lot of other folks on this is really identifying, or here's where public or private money can really make a difference. To leverage that $27 million. And so one of them is trying to get money out quicker, because we know, for example, and that's what we're trying to do right now, the city is they got all this money, but procurement being what it is probably is going to take July, maybe August for those dollars to get out the door. But as we know, the moratorium is imminent, right? And so needing to really move quickly and have dollars available is one big need. Another need is, not to get political, but there are certain populations that cannot be served with federal dollars, i.e. undocumented folks. And we know in our community that's a huge need. And so being able to use private dollars to serve folks that federal dollars can't. And then the third one, and this is where we've been working closely with Katrina and her team at 211, is they are the, not the gatekeeper, but they're the funnel, or where a lot of folks turn to get information about where can I get some rental assistance, and how can, and if typically they're trying to serve X. We know on housing issues, I'm going to make up a number, Katrina, you can nod your head if I'm right or wrong. We think it's going to be like 10X or 20X over the next few months in terms of people asking for that. And how do we, and the system isn't built for that, right? And so how do we help work with 211 and provide resources that allow them to really build that surge capacity to be able to address that need and connect it effectively to the different partners. And by the way, use this opportunity to address some of the challenges that Katrina and her team are already working on to try to make 211 better, and use this as a pilot, a beta test for some of the ideas they're already working on. So that's a second example. And then the third one would be really around testing and our public health response, and trying to be additive, because again, we know in the state of Georgia, the DPH has historically been underfunded and doesn't have that infrastructure just to meet the needs before COVID hit. And now after COVID, it's even more so the case. And so part of it is, how do we bring private resources, philanthropic and nonprofit ability and capacity to help support our public health infrastructure? And so for us, that was helping us to bring a nonprofit group called CORE that's been doing testing across the country, that has a lens of equitable access, and really working and trying to support vulnerable communities with testing, and working with local community partners and hiring folks from those local communities to do the testing so that folks will actually take advantage of it. And so that partnership has worked well in terms of they're a group from the outside, but because they're as part of this working group, there are a lot of local folks with a lot of credibility, being able to connect them such that they're able to really get to the communities and hire locally, so that the folks who need the testing are getting the testing. And so that partnership has been in place now about 2 months, and it's been growing, and they're now deepening their partnership with Fulton County and DPH in terms of taking on more of the testing with mobile sites. And then as we get into the next phase of contact tracing in terms of our public health response, being positioned to help with that as well. And so to me, for us, what we again tried to do with our philanthropy is, there's some of it that's about the money clearly, and so we use our funds to do that. But a lot of it is just about helping to connect the dots through some of our existing partners, both. So again, that balance trying to strike with working with the community-based groups, but also bringing in folks who have outside resources and expertise, or a particular expertise like CORE. They now have done over 300,000 tests across 8 different cities, and they have that infrastructure, they have that process in a way that we don't have locally, but they don't have the relationship. So it's making those connections that makes it work. So but it's a lot of, that's what we've been focused on now. And like Katrina alluded to, we're now over the last few weeks starting to take a step back and think about what does long-term recovery look like? What does resilience look like? And I would say, to close, there's just 2 big things for us that I think are really critical in that conversation. like many small businesses in America, there will be many nonprofits that do not make it through this crisis. And recognizing that we as a foundation cannot completely stop this phenomena, where do we want to lean in to help ensure that strategic nonprofit partners remain in place and are well positioned to address the increased challenges and needs that we know are going to be coming up over the next few years? And how do we go about identifying what I'll put in air quotes a strategic partner is, right? And what's the criteria? And how do we bring a racial equity lens to that work, right? Because that's something we've tried to do historically in the work we do on the West Side and more broadly, but something I think everyone's going to be challenged to do more explicitly on a go-forward basis. And then the second piece is that we, as a foundation, I think this is not just, and I think the philanthropics are more broadly have to do a better job of chewing gum and walking at the same time, meaning that how do we both address the immediate needs of affected individuals and families, as a lot of the support that we and Community Foundation and the United Way have done or are doing now, while at the same time addressing these deeper, more complicated and complex systemic issues, whether be it institutional racism or classism. There's lots of things built into our system that underlie all these disparities, and that is something that is political and gets sticky, it gets racialized, but we have to address it head on if we're going to really have long-term impact in terms of changing this curve, flattening this particular curve, this disparity curve that we have. And again, these are not, I'll end by just kind of echoing what Katrina said. These are not new issues. These are issues that were there before COVID hit. COVID is just bringing them into stark relief. And I think our hope is that given everything going on, the silver lining is that maybe we can make some real progress on these things. I'm a somewhat cynical person, so I don't think we're going to figure it all out. But if we can make some gains, some significant gains, I think that would be a great and wonderful thing. So I'll stop there.
Wow. I mean, all your presentations, I think, represent something that I'm truthfully very proud of. I wanted you all to be on this call today because I thought this story needed to be told. I know you spun up the original fund basically in a weekend. Katrina emailed us some questions about some of the ways we think about decision making at the ARC, and we've given everybody some data. But this crisis has really illuminated some really horrible things about America and Atlanta and our weaknesses. Katrina, Katrina Mitchell used the phrase, the COVID unveiled, right? Some things that I think we've already acknowledged we already know about Metro Atlanta. I got to be honest with you, I was shocked at how quickly the food insecurity became apparent in Metro Atlanta. Nothing to me exemplified how unprepared we were, that was almost immediate. It just took weeks. And this crisis, if we don't learn the right lessons from it, we're really going to struggle to get to a resilient place. And that's why I think these types of webinars are so critical. And everything that y'all have done, like Frank said, I mean, I'm hats off. I've watched this from a distance at times, but I sit on Frank's call in particular, and to watch the silos being reduced and y'all working together is really a strength for me as a planning professional, where I'm not really in a place where the ARC day to day is working on crises, but we're thinking long term. But it has helped us to reformulate it the way we think about Metro Atlanta and some of the stuff that we want to go forward. I think making sure we understand Atlanta and whatever you said, Frank, about flattening the disparity curve. I don't want to flatten it. I want to make it disappear. And this equity lens is going to be critical for us as practitioners to examine what we're doing, why we're doing it, who it's impacting more thoughtfully. And it's not that we weren't thinking about that before. And so, with that, I want everybody else on the call to hear, what do you think, in particular, Community Foundation United Way, because there's 3 of you, has been that thing that comes top of mind that's been most important for you, that you're doing differently than what you were doing before, a mindset and how it's changed in a way that everybody else can hear it, to make sure that we're thinking about it as well, that we're not exposing ourselves to a blind spot that we should have already caught about the way we have to be in working with these communities. Katrina's or Lita, anything you want to add on that initially?
Yeah, maybe I'll start. And so I think there's two things. One, I think it is, Frank lifted up the flexibility and nimbleness. I think all of us are institutions, and philanthropy is not known to be nimble or flexible. And I think this moment in time requires us that we have to be. Lita is absolutely right. It was over a weekend, which meant that our staffs had to be nimble and agile and have to, rapidly respond and move quickly. And so we didn't have the, long white papers to determine whether you do X, Y, or Z. Like, we had to make decisions and be flexible. And then the second piece I think that is important to remember is that these systems can be redesigned, right? Like, we can rethink what we need to do. And so I think that's the other piece that we always have to remember, is that while this has been a challenge for decades, we can undo it, right? And we need to start. And I think no action is not good. We have to act, because as you can see just from this alone, large swaths of our community that impacted all of us. The fact that the supermarket was closed impacted all of us. The fact that restaurants and businesses were closed impacted all of us. And so it not only impacts those underserved communities, but we all have to deal with the consequences of our inaction. So that, to me, I think, are the big lessons learned and moving forward.
So I would add that, we talk about how much we can research and talk with each other, talk with the planners and the doers, but how much do we connect with the community, right? And so we've talked about not shifting away from being very transactional and from I'll say doing things to others, right? Like imposing our process on others, and shifting away from that to working with others and really listening to folks and connecting in a meaningful way, where you really just slow down and hear somebody's story, even if it's listening to a nonprofit talk to you about, I'm a provider of an after-school youth development program, but I am so connected to the 300 families that I serve. And during COVID, my 300 families couldn't access the food that all these other providers were offering because they don't have transportation, things like that. And really listening to folks to identify what are the many solutions, to a need, and not being constrained to, well, people have to be able to go somewhere to get something, and just trying to be flexible with folks to really be able to serve them.
Yeah, I think that's an amazing point, and it implies that, like, a slowdown, right? That phrase, I'm going to remember that phrase forever about the turtles, Frank. But if you're just taking, we do it all the time at the ARC. Here's our application process. Submit by this date. You are not providing those moments to hear people, and it means you have to be a little bit maybe slower in making decisions, because it's easy to rely on a 211 data stream of questions versus actually getting to that point where the interconnectedness of a community. And that's a different model, I think, that I'm hearing you guys talk about. And that, Frank, something you said really stuck with me too, about not being dogmatic. I don't think I've heard you say that before, and if I've missed that, I apologize. But this idea that you try very hard as a foundation to be values driven. You have frameworks for decision making, but I think it's unique that you're saying one of your frameworks is not to be dogmatic, and so, how has that played out in some of the decisions you've made, where, maybe that's, at times it could be in tension, between your value system and the recognition that you need to be in this moment in a real way?
Yeah, no, I think one of the tensions, for example, that I know we all have felt over the last couple of months is that we want to be responsive, and one of our core values is a family of business, as a foundation, is listen and respond, right? But when you have to get out and deal with a crisis and get food, for example, out like now, you can't necessarily fully do that. And so there's a tension there, right? Because it's not perfect, right? In an ideal world, we'd be able to get more feedback, talk to people. You don't, so you got to move. And I think, again, I think the United Way and Community Foundation did a good job of balancing that. Like some of the first grants were to some of those larger players who we know have scale, we know have that distribution network like food banks, the Y and others, to move fast. But it is, so I think sequencing matters, but always keeping, if you keep the core things you want to make sure you accomplish in mind, you can think through how you do the sequence and strike that right balance. And so much of this stuff to me is about a healthy tension, right? Where, for example, we're, even before this crisis hit, we were going through this whole process of how do we simplify our applications? How do we be more responsive to, for us, we have dual customers, right? We have the end user, which is the families and individuals we're trying to have a positive impact on, and also our nonprofit partners. And so how do we try to be responsive and listen to both, recognizing that there's still a balance in terms of there's certain things we need to do in terms of from a due diligence perspective to make sure, because again, from as staff, we're stewards of, for Arthur, it's his money. We work at, the pleasure of the king kind of thing. But we're both an advocate. I have to wear these two hats of being an advocate for the community, advocate for our partners, but also an agent for Arthur and making sure we're using the funds consistent with what the vision of the foundation is, what their priorities are, and striking that balance. And I think, to me, to do this work well, you always have to live on that edge, and always have this healthy tension and this push and pull between kind of the internal kind of needs and so on with the external. And I think, and I've shared this with others, I'm relatively new to philanthropy. I've been in it 6 years, and I was a nonprofit practitioner for a long time before that. And I didn't have a high opinion of philanthropy before I came to philanthropy. And I joke sometimes, I still don't, but it's neither here nor there. But I think part of what, at least what I try to do, is push philanthropy to recognize that we got to listen to our nonprofit partners, because this work is really hard, and it's even harder during this crisis.
It really is. And Katrina DeBerry, I know we talked about redesigning. Given that you've seen so many applications come through the Community Foundation, what would you say, from your perspective, if you could do something differently and kind of manage that? I mean, when I heard that y'all had gotten 600, like, that says so many things. It talks about need, and I mean, it would be terrifying for me to have to work through that, and y'all did. Like, again, hats off, but you've got some lessons in there about what that really means.
Yeah, I mean, I think collaboration and partnership was the biggest help in getting through those applications. But I think in this moment, what we've had to do, similar to what Frank talked about, is to reassess what is necessary, what information is necessary for us to meet the needs of our nonprofits in our community. What things are we asking that are too much for this moment? And what things can we still be able to make good decisions about without overburdening people and creating more barriers to access, right? So we want to create more opportunities. We have to be open-minded enough to say our way, our 75-year history doesn't always mean that's how we go forward, right? So we have to make some changes within. I also think that in this space and time, the express acknowledgement that racial equity is what we're trying to drive toward is something that we have to take a bigger look at, right? I don't think we have the luxury of not being explicit in the work that needs to be done, should be done, right? So when you are looking at data points and the data tells you that the racial component is what exacerbates these issues, then we as philanthropists need to be able to provide that information to our donors, to our nonprofits, and to the work that we're trying to do internally. So this work is hard work, and it's work that I believe that we all have a personal connection to, and that's why it's so hard. but it's definitely worth that effort to make those changes.
Does anybody want to add to that? About, okay. Katrina? Mitchell?
I was just gonna add that I think so much of this work is about your heart and your mind, right? And it's an art and a science to it, which means that, you know, it doesn't have the rule book and we all are trying to navigate it. But I think all of us are saying that redesigning what this looks like means listening, and listening to those lived experiences has to be a core part of how we do this work. Not just what we know is evidence-based, but also what are the lived experiences of individuals, and how do we then invert that burden and really pay attention to that in how we support agencies and nonprofits and how we deploy resources.
Yeah. There's something else that I wanted everyone to talk about for a second, because it hasn't come up specifically, and that's really racial justice. You know, we see all these impacts with the COVID crisis, but we are in this moment where we're again seeing the inequity of the justice system in the United States. And I know from a foundation standpoint, we're here today really to talk about what you've been doing in the COVID crisis, but I know this is coming up in your work. And if anybody wanted to speak to some of the lessons along this path that you've been on recently with respect to racial justice, I know everyone on the webinar would like to hear from you. Anyone? I know it's a...
I'm happy to chime in just because it's been top of mind for us, and we're actively working on it both here within the foundation and across the businesses. And so what I will say is we'll be releasing tomorrow. We'll be doing a press release tomorrow with an initial round of what I call racial justice investments that are trying to be responsive to the moment and really focused on some of the issues around the murders here in Georgia, in Atlanta now, as well as some of the more systemic issues around that kind of connect to police brutality, mass incarceration. And I think one of the things that philanthropy is going to have to do, and I'll talk about Southern philanthropy because, again, I've only been in this philanthropic world for a minute. And from where I sit, Southern philanthropy has, with some exceptions clearly, but a lot of the private foundations, I'll just say that, have not been as willing to really address this issue as much as they should. And my hope is that the current moment will push people off the sidelines to really engage in this issue in deep, meaningful ways. And that, I think, is not just about, okay, we're going to make some grants to a few organizations, Just Georgia, the NAACP and all that, which is, again, that's not a bad thing. Those are helpful and important parts of the puzzle, but they cannot be the only thing that foundations do. I think the other two things that are really critically important are, one, bringing, and I think Lita alluded to this, bringing an equity lens, a racial equity lens specifically to the other areas, right? Because I've given this example multiple times now where, that's one of the first things we're trying to do is more and more lift up these interconnections between whether it's COVID-19 and racial injustice issues or youth development, racial injustice, because these issues are just, they permeate everything. And so I think it's not an either or, it's a both and, where you bring that lens and are cognizant of it, especially if you're concerned about disparities across all your program areas. But then there is a body of work that is very explicit to criminal justice reform, for example, that you need to lean into, in addition to thinking about how it plays out within a context of youth development, for example. And the third one, and this is one that we're grappling with in real time, is then how do you bring that mirror to yourself as an organization, as a foundation, and your practices in terms of hiring, pay, just engagement within the foundation. And then for those of us who are connected to businesses, how do we help lead those businesses in thoughtful ways? Because I just had this conversation earlier today with some of my colleagues, and I'll just, I'm super blunt. I can tell you, having interfaced with a lot of our leaders at the Falcons and United and some of our other businesses, the term racial equity, institutional racism, implicit bias are not terms they use every day, right? And that's okay, or it's not that, actually it's not okay, but we have an opportunity. And so to me, those are some of the things I think that we're grappling with and we're going to try to lean into, and I hope that other foundations do as well.
Yeah, and I would just throw a word out there about power and who has access to power. And one of the first lessons I learned when I entered philanthropy 3 years ago is that there's a privilege to being a funder, and that we have to recognize what that privilege means, and how not to, throw around our power, but how to share in responsibility, right? So what things are we doing that not empowers, but helps to recognize the power that communities have already, and how can we support them in growing that power so that they can make decisions for themselves, and it's not just us wielding our influence over people who already know what their needs are.
Yeah, and it always comes back to me to the Robert Caro about Johnson. Power reveals. Power reveals, right? What you do with it once you have it is going to demonstrate, real character. So that's a great point, Katrina. Okay, so with that, I think if anybody wants to say any closing remarks, I always want to, any last questions from the chat. I want to say thank you so much for being here with us today. Thank you for all your work. I mean, when I hear, I'm talking to my colleagues about you as people in this world, the word that comes up the most is exhausted. You've been working so hard, and you may not be exhausted or feel exhausted, but it's only to say we know you've been working so hard for us as this community, and that's the thing I want to thank you the most for. And I am so excited about the things I've heard today about reducing the silos, changing the way we're doing things, trying to be more resilient long term, because these are the things we've got to be focused on coming out of the crisis. So with that, unless anybody's got anything else, the next webinar information is in the chat if you want to look at that. And again, finally, thank you for being with us here today on this webinar. Enjoy your days. See everybody soon.